Hello, Pearland, and thank you for joining us again. My name is Josh Lee, and I'm the Director of Communications for the City of Pearland and the Public Information Officer. This is your April 22nd COVID-19 update. So since the beginning of this pandemic, we've been working really hard to bring you relevant, timely, accurate information. And one of the ways that we do that is with these public service announcements that we've been trying to do on a weekly basis. Today, though, we have an extra special guest with us, Dr. Stephanie Campbell, who's an internal medicine physician at the Pearland campus of Kelsey-Seybold, which is also a company that actually happens to be headquartered right here in Pearland. So we want to take this opportunity to get a perspective from the healthcare industry on observations and recommendations that might be relevant to the city of Pearland. So Dr. Campbell, thank you so much for taking time out of your probably unbelievably busy schedule to join us here. And we'll try to make this as quick as possible. So from your perspective, obviously Kelsey-Seybold is, and I don't want to put words in your mouth, but they transitioned to mostly telemedicine, video conferencing, things like that.
Absolutely, yes. We've gone full virtual unless it's an emergency, and then we will still see patients live, but we've done everything else virtually.
Interesting. And what have you seen since COVID-19 sort of impacted the Pearland community? What sort of trends are you noticing?
So I'm actually seeing a lot of anxiety, a lot of situational anxiety during this time, not related to health, finances, being isolated from friends and family. And so I do spend a lot of time counseling and giving people resources for that.
What sort of resources do you recommend when it comes to dealing with those types of issues?
So I do recommend that people try to establish some sort of routine so they still can maintain some semblance of the life they had prior to this. We also recommend mindfulness, meditation, exercise is great for anxiety. Maintaining a good nutritious diet is also very important. And then I recommend they do sort of Zoom conferencing or messaging, so they can maintain that relationship with friends and family. And there's actually a lot of psychologists and psychiatrists within the Pearland area that are doing virtual health visits. And so if they go to www.psychologytoday and plug in their zip code, they can find people that are available and willing to do virtual health visits.
Interesting. So stay healthy, stay active, stay connected, and stay on a schedule of some kind.
Yes, absolutely. Nice summary.
Thank you. Yeah. So what do you think, in relation to this pandemic, your main message that you're trying to get across to your patients or to the community at large? What's the most important thing to focus on right now?
Well, it's important to focus on health and nutrition and, like you said, connectivity. I mean, those are things that our physical health and our mental health are very closely entwined. And so if one falls, the other does. Sure. And so it's really important to not, sit at home and lose all of our nice routines that we had before with exercise. And, it's tempting to grab things off the shelf that are non-perishable and easy to make. And those aren't always the best nutritious options. And so, sure. We talk about sending other people to the grocery store to get fresh produce because it doesn't last for 2 weeks, unfortunately, or doing shipped and having it delivered. That way we can stay healthy in more ways than one.
Awesome. Well, thank you for that. We really appreciate that update. Pearland residents, as always, stay safe. The stay safe at home orders are still in effect. So if you have to go out, use social distancing. Brazoria County is recommending to wear a mask, face covering when you go into public, and also use appropriate hygiene, wash your hands for at least 20 seconds, and stay home if you absolutely can, and stay safe during this time. Thank you for joining us, and thank you again, Dr. Campbell. We really appreciate the time.
I appreciate it also. Thank you.